World Health Organization has alerted the world over a possible emergence of a rare inflammatory disease in children that may be linked to the coronavirus. Head of Emerging Disease Unit, Maria Kevkov, says the cases are similar to Kawasaki disease in a few countries, including the United States and Italy. She also revealed that the syndrome can cause high fever and swelling in the blood vessels, as some children have tested positive for COVID-19 and others have not. Now, clinical pharmacist and the United Nations Sustainable Development Goal advocate Adaku Efuribe joins me via Skype to discuss this development. Thanks for joining in.
Well, thank you for having me today.
All right, Adaku. So we have a new development called the Pediatric Multi-System Inflammatory Syndrome. Tell us about this.
Well, recently we've had reports from Europe and North America, and it has described a cluster of children and adolescents who required intensive care unit care. And the PIMS stands for a pediatric inflammatory multi-system syndrome, and it describes a new health condition seen in children who have been infected with the novel coronavirus and they've recovered from it, but they've also gone later on to have an immune response that results in significant levels of inflammation in organ systems and symptoms. So the PIMS is also similar to other inflammatory conditions like the Kawasaki disease and the toxic shock syndrome. Children who have PIMS generally do not have obvious symptoms when they are infected with the novel coronavirus, like cough, and generally they are healthy prior to developing PIMS.
Is this something to be bothered about?
Well, at the moment, we've had the reports of this happening in Europe and North America, but it is something we have to be on alert for. We have to know the symptoms of PIMS, and we have to understand what to look out for and when to seek urgent medical intervention.
All right, so tell us what to look out for. What are the symptoms?
Okay, the symptoms of PIMS, like things like abdominal pain without any other explanation, and also sometimes children present with both eyes appearing pink and red, and sometimes they can have enlarged lymph nodes, which is the lymph nodes are the glands on either side of the neck. And some children also have fever for 7 or more days, and also red cracked lips or red tongues, just as red as strawberry, and sometimes they have rashes all over their body, and also they can also have swollen hands and feet, which might also turn red. So the classical symptoms are rashes all over the body, swollen hands and feet, redness of the eye can be red or pink, so, and also abdominal symptoms. So it's just for us to have an awareness around this, and the symptoms can develop so quickly. So for us to always seek medical intervention in good time.
Okay, so we've had cases in Europe and the US so far. Have we had any in Africa?
No, we haven't had any case in Africa at the moment, recorded at the moment.
Okay. All right. Thank you so much for being a part of the discussion, and thanks for sharing your thoughts. Adaku Efuribe there.